don't know what to call it. If you want to really help a church, just go get the BQs of that church. I think that's the last I saw the former president doing to Ridgeway's Catholic Church. And it took some good money, yes, but he brought everything. So maybe what the president just needs to do, if you want to help the church, ask them their BQ and send them the cement they need. Just tell them, we have paid for whatever you want to start building with. It will be delivered, the stones. Also, it helps to be accountable to also the monies you have given. You will see everything coming. Because why Christians want you to announce is because they are also clustered as families to contribute, isn't it? And you see that in our Catholic Church. So we contribute. We contribute in Jumuias, we contribute in that. And so, in the end, don't think they don't question. So
when you contribute in Jumuias, you belong to that church? It's not a friend's church?
No, I'm just saying I will bring other friends, yes.
Yeah.
But I'm just saying why Kenyans will want you now to announce is because since we have been contributing, and I'll say this because I went to an SCK church in Kirinyaga.
Yeah.
Went with a friend, we were 5 of us. We took our tiles and everything. We took a whole truck of the things we wanted because of her mom used to go to that church. And she was late and she had promised. So we went to finish. We went and counted everything that was needed. But then in the end, we had shows asking, they were asking in Kikuyu.
You want to translate that for the
they were asking, and that's the money we removed now. What is it going to do since they brought everything? So that is why I've told you the problem we face, which all Christians, we must pray to God to help us, is to be trustfully to the things, both from the church side and from the politician side. Let us be trustfully to God. That even when you're giving, it is going to do the work you have said it's supposed to do.
Now, Senator,
one thing I've come to realize in our country, we are very interesting people, And I'll just say what I said in Parliament. You see, it is important. I think the people who have the idea, this universal health care, yes, really, every president has really tried to push this thing. Fine. So we are here now. But then the question now that I will ask, which I think the person who will be good to answer is the MOH accounting officer, who is the PS. Number one, when you hear the Auditor General, then you come and ask yourself, is the system a service model where we are leasing the way we did the first project when I was in Senate of leasing equipments? Is it that model? After he answers that question, then you tell them. So it is, in a layman's way, I'll say it's like the expressway. Because when she says the monies must go somewhere, it means government did not remove any money. There are people who have serviced this thing, and you need to pay them as Kenyans for you to use this ecosystem that I see was so large that either carries the facilities, carries the devices, carries connectivity, carries every storage, cloud, all those things. And then the person who has been given this responsibility, who they trusted, I'm trying to think through some. So it's just it's Safaricom, because it's the largest connectivity internet company that we have, that has internet, that has infrastructure. But the question now will come back after that, is that after they took Safaricom, we have leased the service, the best they would have done, and this now, and I'm sorry, it brings in very many other agencies of government, because the AG also is there to say he advised before you even arrive at Treasury to say now you are being given a leeway to use what in the Procurement Act, which is legal, because they used one of those options we have given on how to procure. So, and then you ask yourself, so who runs the registration platform? Who is this person who is running the operations where Ministry of Health has roughly 19 institutions? Are they on this platform? And I'll give you an example. Did they want to try to do what now Governor of Murang'a is doing?
What 19 institutions?
Well, we have KEMSA, we have NKNH, we have all those. Are they part that they will benefit on this magnitude system that I asked in there? I'm asking the same questions I asked Pokose one time when we were doing this in the House.
Yeah.
That you see, you need to clear people's minds to understand. And so even when the Auditor General is coming, so who is the internal auditor of MOH? Because before she brings out this, definitely I know her team walked in and they asked. And for her, it means...
But wait, Mheshimiwa, and sorry
Yes.
to cut your trail of thought.
Yes.
The Auditor General and also the internal auditor, they come in after the fact, if I'm not mistaken.
No. The internal auditor, why I have employed you as an internal auditor, is to help me to guide whether my systems are functioning before the external auditor comes and audits
No, what
me.
I'm asking is, does the internal auditor audit the procurement process, or they wait for you to conclude, then look at it?
You see them, they have an opportunity. That's why we call their internal, they are ours. When we are continuing with the process, our legal teams that are within our institution are supposed to be guiding us, isn't it? They are guided, then they go to the AG, they ask, the AG also gives his own external advice of what he feels, whether it is right or wrong, where you are headed, and you keep those reports. Then now the internal auditor, after you have done, yes, but before it even comes out, he comes in and he audits. And he tells you. That is why you'll find sometimes...
The problem with the internal auditor or the procurement...
No, I'm not saying that, no, it starts from the procurement.
Right.
So I cannot say the problem is internal. I'm just saying, for her to pick now that, she's picking it from the reports that themselves, MOH, have already produced. So it means, did you advise your clients well? Or what was the problem? Or they did not want to hear? So if those are all the questions we are going to ask, then we shall say, from the process beginning of the whole thing, there's somewhere each one of you, do I say we're sabotaging each other? Yeah, but one thing we need now to understand as Kenyans, the model. You know, the moment we understand the model, we'll stop talking to government and we'll start looking for who are now the owners.
Okay, all right, and we'll get to the owners.
And for me, it is sad when Manzo say members of parliament took money, and you have confirmed. So all of you, even senators, you normally take money. Is that why you're doing all these babalus with national things? But having said that, Sam, this is a program that absolutely was agreed then at the African Union, that every country in Africa must go through universal health care program. And when Mozo was giving the report recently, he said Tanzania is doing it. The question now we should go back as Kenyans is, as we look at things, because the problem with Kenya, Sam, we look at it, what is in it for me, before we think even it's health, and it's for the people, and it's human. So that is where the biggest problem, that is why some will be fighting to go back to NHIF, what was in it for me then that has been locked by SHA. But now we go back, I go back to the same question. Your 104 billion, it means we leased this system. And so we shall be paying it for the next 10 years. We need to be told if that is it. So that we tell Kenyans, so you have not lost money, but the money now you are paying is part of paying for this system. We have to be very clear on that. After that, we need to say, for me, I have registered people on SHA, Sam.
Yeah.
I have 6 patients at Kenyatta, one who has been in ICU from December. If that young man didn't have it, would have been lost.
Okay.
So it is, yes, good, it can support Kenyans, but as we end, what is in it for me, Kenyans? We must get out of that madness.
All right.
And stop reminding us NHIF, but focus on this thing and deal with those who have made it wrong and make it work for Kenyans.
All right.